We are wrapping up Breast Cancer Awareness Month, the month of October, but of course it's a topic to talk about all the time. If this is something that you are currently battling or have gone through, or even just you know someone or have a family member or friend who is dealing with a breast cancer diagnosis, we want to offer as many resources as possible. And one of those is how care works at different medical facilities in our community. I'm joined now virtually by Dr. Christina Gaunt. She's the co-medical director of the Trinity Health Breast Center at Lakes Village in Norton Shores. Dr. Gaunt, thanks so much for joining us for this. You guys really have an elaborate process and team and tools for people who are dealing with news that can be so difficult. We appreciate you being here with us. I'll have you start off with just telling us a little bit about what this program looks like in general for folks facing that diagnosis.
Absolutely. Thank you so much for having me. Our process is pretty elaborate. We have a full team that includes nurses that are along your side for any biopsies that you may need. We have radiologists on site to do diagnostic imaging as well as screening imaging. We also have nurse navigators that will follow along with patients if they do indeed receive a diagnosis of breast cancer, that follow along through their entire journey. We have a high risk clinic that is present in the same facility that is run by a genetic counselor. We also have multiple breast surgeons that are available for patients when they receive a diagnosis. We have a plastic surgeon, we have a medical oncologist, and we have a radiation oncologist as well. And so we have a physical therapy team and a lymphedema team. So it's quite the robust team of people.
Yeah, I mean, someone who has never gone through this process, and of course, we hope people don't have to go through it, but you might think, oh, I just meet with my one doctor, and it really is a team. That's what you guys call it, a breast center team of all of those people that you mentioned. I want to go back to nurse navigators that you mentioned, because as folks can imagine, you know, this is a lot to deal with, so many people to see, appointments. How do those nurse navigators really help to make it as easy as possible for patients?
Yeah, so the nurse navigators are my right hands. They absolutely care from the patient from start to finish. They oftentimes are present during the biopsy. They help ease any anxiety. They will make sure that all of the testing is done in a timely fashion. They'll coordinate the release of those results to the patient by phone. They will also make sure that their appointments are attended and that the patient knows where to go and when to go, because it is so many people that they are involved with after a diagnosis. They will also call them and check in with them throughout the entire process and the journey to make sure that, you know, surgery went well. Do they have any questions? Do they have any concerns? And they'll reach out and coordinate care between myself and the oncologist or the radiation doctor, just to ensure that the patient's care is being provided in a timely fashion and that the patient has emotional support as well. They'll coordinate emotional support groups. And we also will connect patients that really need that extra person to talk to and just connect with. They'll connect previous patients with new patients.
Yeah, absolutely. I mean, so many different elements to making this as easy as you guys can, even though, of course, it's not anywhere near easy. As far as the response you guys have seen to the process that you guys carry out, you know, this is how you treat your patients who are dealing with this kind of a diagnosis. What's the feedback been on having this really network of care that you guys provide?
You know, at first, patients are so overwhelmed with the diagnosis. And I get feedback from patients all the time that say, this has been an amazing experience. So while it is a scary journey, the process and the support that they receive from our team, they're not, they're so happy with the care that they've received that they really feel it as a positive experience.
Yeah, absolutely. And walk me through a little bit about, you know, what motivates or, you know, what encouraged the setup that you guys have. I'm sure there's so many different ways to handle a breast cancer diagnosis and run a breast cancer center. What was the motivator, you know, just behind doing it the way that you guys do right now?
Yeah, motivation is really just to coordinate care as best we can for patients to make sure that it's very quick. So we have a lot of guidelines that are set aside for breast centers in general throughout the nation. And so we use a lot of those guidelines to ensure that we are meeting them But one of the things we just wanted to be the best that we could be. And in fact, we are one of the best breast centers in all of Michigan. It's pretty exciting, the accreditations that we have been able to attain here. And that motivation really is just all of the patients locally. We have a huge number of breast cancer survivors in the area, and our funding and philanthropy in town has really helped push funding to make the breast center as best as it can be.
Yeah, and as we wrap up Breast Cancer Awareness Month, of course, thinking about breast cancer, talking about breast cancer is important any month of the year. If anyone's watching right now and they have a concern or they have a question or they think they may have found a lump or a bump or something, what do you say to them about seeking help?
You can schedule a mammogram without getting any orders from your primary care physician. You can even go on to the MyChart app through Trinity Health or onto the website, and you can schedule a mammogram to be seen. If it's a diagnostic mammogram, so that means that you feel a lump yourself, then they will request that a primary care provider sees you to evaluate that and orders a specific type of mammogram so that we can ensure we're getting the appropriate imaging and get you cared for the way that you need to be cared for. So if you feel something, say something, don't be scared, don't wait. I can do far less invasive procedures for patients if they're showing up early with their diagnosis. And so early diagnosis is key.
Absolutely. All right, Dr. Gahn, thank you so much for joining us. So much helpful information and hopefully reassuring for folks out there who may go through this at some point or who are going through it right now. We really appreciate your time.
Thank you so much.